Some healthcare workers say they're optimistic about the Johnson & Johnson vaccine. The country has finally begun rolling out the first phase of the vaccine drive. See, the country's first citizen, some frontline workers, including the Minister of Health, that's Dr. Zweli Mkhize, were first in line to receive the jab. So let's discuss this with Dr. Donald Gumede from the National Healthcare Professionals Association. Doc, good to have you and good morning to you. I mean, how are you feeling about, this vaccine finally being here and seeing, of course, those images of the President, including the Health Minister and the first nurse to get the jab?
Thank you and good morning and good morning. Thank you for inviting us. We are actually, I like the underlying word optimistic, because indeed we are just optimistic because we must tell the truth to the nation. The vaccines are still at the research stage. No one knows exactly how the vaccines are going to work and all that. So we are at an experimental stage, but it's a step in the right direction that actually the healthcare workers are considered first this time. Because if you remember, during the PPEs, they boggled the whole rolling out of the PPEs. The healthcare workers, they never got the right staff to protect themselves. So as such, I'm happy that they've considered the healthcare workers, but I'm not necessarily celebrating, because for us to break the cycle of the pandemic, we need to have inoculated almost 60% of our community, which you're talking about around 36 million people in our country.
Right. So
it's not an easy thing to celebrate at the moment.
Doc, when you say the vaccine's at a research stage, what does that mean? Because I saw that statement kind of divided social media even yesterday with those images coming through, because I suppose due to lack of understanding and thorough, messaging, some South Africans thought this might be the silver bullet that we were all waiting for.
I appreciate actually the question, because remember, Johnson & Johnson started this project in 2020 in June, and then the implementation thereof was in July, where they started. So all the information that they're giving you is current information. It's not something that is research or thorough research. If you go and check, even they don't know, if we were to ask them how much immunity are we going to have, or how long is it going to last, they don't know. And it's easy, it's because it's still under the experimental stage. So we are actually not in a state where we know what the vaccine does. We don't know at all. We have no idea how long would you be covered for your immunity. And as such, look at it this way. Even the people who have been positive, we don't know how long would does their immunity last in their system. Others says 90 days, which is around 3 months. With the Johnson & Johnson vaccine manufacturers, they won't be able to divulge how long would you be protected. And having said that, it's actually a long way to go, to be honest with you, because remember, we have got TB, which we have got vaccines and treatment, and still the #1 killer in South Africa. You have got your flu jabs that you get to. I'm adding to the question that the social media people are asking, which is true.
Right.
We give you flu jabs every year, twice a year, and you still get the infection, and you still have influenza and end up in ICU, some of you. So it's not necessarily the alpha and omega of treating the pandemic. It's just another means to try and curb it. Like I'm saying, we've got something that we call herd immunity.
Right.
Like I've explained earlier on. We need 60% of us to be inoculated or vaccinated or infected for us to break the cycle.
But, Doc, in other words, what I'm hearing from you is that in as much as the Johnson & Johnson vaccine has arrived, it's still in its research stages, the responsibility and the onus is still on South Africans to ensure that they check their behavior, meaning they still need to continue wearing masks, social distancing, despite this vaccine rollout currently being underway.
100%. To answer you, it's extremely 100% what you're saying, because it doesn't necessarily mean that if you got the jab, you cannot transmit the disease. It doesn't mean that you cannot get the disease. So until we get to that threshold that I'm talking about, there's no celebration nearer. And let me put things into numbers. We have around 80,000 of those jabs from J&J. And compare it to 36 million people that need to be inoculated. We are not even at 1 million. We are talking about 80,000. So it's just the water in the water drop in an ocean. So we are far from making any serious inroads. And worst of it all, with our ailing economy, where we can't actually acquire more vaccines, I'm actually waiting to see where are we going to get the money to actually have more vaccines to inoculate the population, because it's not only about the healthcare workers like I indicated earlier on.
Right.
It's about the country as a whole.
All right, Doc, we have to leave it there, but thank you so much for your time this morning, Dr. Donald Gumede from the Healthcare Professionals Association.